Hello, I'm Dr. Michael Corradino, and I am the founder, creator, and president of the Neuropuncture organization. Neuropuncture is the only complete neuroscience acupuncture system that specifically teaches the practitioner, you, how to neuromodulate your patient's nervous system back into health, specifically using electrical acupuncture. Now, neuropuncture was created by a classically trained acupuncturist for the classically trained acupuncture. All of our treatment strategies and prescriptions are research supported, neuroscience evidence based, and all this helps to reproduce clinical outcomes. Now, this particular year, my topic and theme is going to be neuropuncture and the treatment in PTSD, post-traumatic stress syndrome. Now, disorder. There's a reason why they are called disorders, and we'll get into that, right? They're not labeled diseases. And we're going to get into that. That's going to give us a little bit of identifying factor of why we have to approach it in a very specific manner. So now PTSD drew my attention because of my relationship and my work with the veterans. I have done as much as I could for them when I have the ability to do that. I'm very moved by our United States veterans. I think they're all warriors and heroes, and some of them are super people. They really are. And for what they do for our freedom, I just do whatever I can to help them. And I was watching a podcast with Jocko Willink, a Navy SEAL commander who I actually know, and his interview was with Dakota Myers. He's United States Marine Corps Medal of Honor recipient. And his story, check it out, is so moving and so heart-wrenching that it just drew me away from my work and forced me and motivated me to find a solution in neuropuncture for PTSD. So I dove deep into the underlying root neuropathophysiology, what we understand to date in the area of PTSD. And the reason is because we want to study that and identify what pathological tissue is responsible for this condition. Then we create a neuropuncture AcuNode prescription, the point selection. And then we use a specific electrical dosage to then neuromodulate, neuro-rehabilitate, neuroregulate those tissues back into health. Now, with PTSD, there are many facets. There is no one treatment fits all, okay? So when you understand the neuropuncture system, you'll be able to kind of flow through prescriptions and parts of prescriptions, understanding what they actually do physiologically to the nervous system. We're going to review all of that in this presentation. So you're going to lead with actually a couple nice handfuls of actual prescriptions and strategies to address PTSD. And the three main areas we're going to look at is the first one's going to be the autonomic nervous system and how to regulate that fight or flight system right now in them. Second one's going to be sleep medicine, right? Sleeping is always a big factor for them. Most of them have night terrors, insomnia, and a lot of disturbances at night. And then with PTSD, we always unfortunately hear of the suicide rate. So we're going to talk about depression and mental health. Now, there's a lot of great parts of these prescriptions that just help support brain function and heal the brain. So I think you're really going to enjoy this. I'm going to have some clear pictures, some great cases, and some excellent examples of how to apply these treatment prescriptions. Now, currently, I am involved in some really great groundbreaking research. I have been my whole career, which has been about 30 years now. I've studied and worked in China, in hospitals in America, and I've always been very closely related to the Western medical sciences and the neuroscience. It's something that's always just gravitated to. So I'm always looking to create advanced neuromodulating techniques in neuropuncture. And in PTSD, that has actually led me to create a very, very well researched, but I think extremely impactful and powerful treatment approach that we are now developing in neuropuncture. Now, I'm not going to tease you because I won't be going into depth of that particular technique because that's an advanced technique. You might need ultrasound in some cases, and it's not something just to be throwing out at a conference for someone to go practice in their table and their patients on Monday morning. But all the other prescriptions I will be, okay? And you have a lot of ability and a lot of application to that on Monday morning with your cases in your clinic, okay? So I hope you enjoyed that. Looking forward to speaking to you guys this year and looking forward to teaching at FSOBA. I really love that organization, and living now in Florida, I really love to support them, and looking forward to giving a great presentation on neuropuncture, 21st century neuroscience acupuncture system. And we are going to be teaching you how to effectively manage, treat, and address PTSD and the underlying neuro root pathology in the brain. Hope you enjoyed that. Looking forward to seeing you. Take care. Bye-bye.